The health department reported some 8,300 new COVID-19 cases today, relatively lower compared to the previous days. Let's talk more about this with Professor Guido of the OCTA Research Group. Good evening, and thank you for joining us, sir. So first off, what's your reaction to the COVID figures today? Is this a start of a downtrend, or can it still be attributed to a limited lab data over the Lenten break?
Yes, hi, Jess. Good evening. Yes, the lower numbers could be attributed to some lag in reporting. We're not seeing a downward trend yet. The reproduction number is still high. It's around 1.6. We're hoping that it will decrease to something like 1.3 or 1.2 later by the end of the week. But until then, we won't be seeing a downward trend yet. And we're happy when the numbers are low, like today, 8,000 only. But unfortunately, we'll still see some days when we will have more than 10,000 cases. So we have to brace ourselves for some more high numbers that we may be seeing within the next week or so.
Okay, that's at least that one is clear, but some are pointing out possible discrepancies between the Department Health's COVID numbers and the situation on the ground. For instance, there were only 2 COVID deaths recorded yesterday. What could be the explanation for this?
Well, COVID deaths are normally lagged by 2 to 4 weeks. And in fact, earlier this year, around January or February, there were a high number of reported deaths. And that's because they were from last year, and the Department of Health was rechecking their data. So that is the so sometimes that happens, and when we have delays in reporting deaths, and it could be true this time because we do have several instances, or we've heard of situations where people were not able to get health care, and some people died, in their homes, and those cases will not be reported as deaths immediately. So it will take some time, but we are still seeing a fairly constant death rate, and the increase in the number of cases will mean that there will be more deaths that will be reported in the future.
Okay, so do I take it to mean as well, sir, that the DOH is limiting their data when it comes to death or fatalities to those that were actually admitted in hospitals?
No, not necessarily saying that, because I actually have no information on how they tally the deaths, but we're just citing some possible cases where the Department of Health may not be aware of certain deaths, or sometimes deaths have not been reported yet, because sometimes I believe they have to go through the process. So it's not because this is the way they are reporting their deaths, and I'm not familiar with that. I'm just citing a possible example wherein the deaths may not be reported yet to the Department of Health.
All right. So when do you expect to see the results of the ECQ in the NCR Plus bubble? Do you think the 1-week extension is actually enough to effectively at least bring down cases?
Well, Jess, we hope to see the results by the end of this week. And as I mentioned, the reproduction number has actually decreased from 1.9 to 1.6 as of yesterday. So we're hoping that the reproduction number will decrease to around 1.2 or maybe even 1 by the end of this week, by Sunday. And if that happens, that means that we will be moving to a downward trend, which is what we want to happen. But we can't really say right now, so we'll just have to wait and see until we get the results by the end of this week.
Okay, Professor David, one other thing, of course, that we are keeping a close eye on, hospital occupancy utilization rate. I mean, at this day, you have 79% of ICU beds already occupied. If there are still unutilized beds, how come that some families are reportedly driving all the way to provinces, or in short, doing hospital hopping just to seek care for their COVID-positive members?
That's another good point, Jess. And unfortunately, I don't have the answer to that. And I think we would have to maybe ask that to the Department of Health, because we are seeing numbers that are, like around 70% occupancy. So there are still supposed to be beds available for patients. But from the ground, I hear from doctors who work with us and from my sisters who are doctors also that their hospitals are basically full, and they can't really admit cases unless they're really urgent. And so that's what we're hearing on the ground. And based on some people I know, they've been trying to seek hospital admission, and they have been unable to do so. And there is some discrepancy between what we're hearing on the ground and the data being reported by the Department of Health. And unfortunately, I cannot answer that because, we only look at what the Department of Health puts out in terms of data, but we do not cross-check that with the hospitals.
Okay, now, I mean, given that, of course, this is something, of course, that the Department of Health has to answer as well. But how are hospitals getting full if roughly 98% of the cases are mild? Private hospitals, in fact, claim that they are only admitting moderate to severe cases.
Well, based on our projections, and this was done by some of our colleagues, Father Nicanor and Dr. Michael T., and they made projections that based on these assumptions that hospitals will become full even though most of the cases are mild and asymptomatic because of the sheer number of cases that we are having. We're getting an average of 10,000 cases per day, and some of those will definitely seek hospital care. And when they get admitted in hospitals, it's not like they get checked in for 1 week and then they get released after that. So it takes some time for them. So their hospital stay can be up to 3 weeks or even longer, and that will account for the piling up of cases in hospitals.
And lastly, Professor David, before I let you go, earlier in the day, I was able to talk to Congresswoman Stella Kimbo, and she did suggest, enforcing a more granular lockdown, this time around, isolating households, families with COVID-positive members. Have we come to a point where measures should be this aggressive?
Well, of course, I think the national government is seeking solutions, creative solutions for our COVID problems. And, this is something that they can definitely, they can definitely look into what their options are. Instead of having an NCR plus ECQ, we could resort to maybe more localized lockdowns, but we're not sure about, household lockdowns yet. That's not something we have looked into, but definitely we can do more localized lockdowns after this ECQ, because what we're seeing is that the trend in Pasay is actually on a downward trend now, and in Makati and Parañaque, the cases are already plateauing. So that means it's close to going to a downward trend. So even though the whole of NCR is not yet on a downward trend, some cities in NCR are now on a downward trend or moving close to a downward trend. And if that's the case, if most cities are already on a downward trend, except for a few cities which are still having an increase in cases, then maybe we can think about having localized lockdowns for these cities that are lagging behind in terms of the downward trend.
All right. Thank you very much for those insights, Professor Guido David of the OCTA Research Group. Thank you, sir.